We're at a very interesting time right now when it comes to the coverage and conversation around the coronavirus. As we speak, the numbers of infected cases in Wuhan and the Hubei province and all across China are increasing. Tragically, so is the death toll. Now, the number of cases in other countries and Western countries is increasing, but ever so slightly, and the Canadian increase is very small. The number of suspected cases is actually decreasing. Most of the tested cases roll over and end up being negative, that the people they thought may have it actually just end up having the regular flu or something else. So that's good news, I guess, from that perspective. But there is still a lot of alarm after the World Health Organization called this a global health crisis, that Canada is perhaps not doing enough and doing things a little differently than other countries. And you got to step back and you've got to wonder why. There are some concerns about the politicization of public health officials. I remember I first thought this back about 8 years or so ago when there were public health officials in cities all across Canada and also in the United States who all jumped on this bandwagon advocating for a pop ban, a soda ban, or some sort of tax. There are different variations in different cities, but you get the idea. And I thought, hold on a second. Even if you think these bans are a good idea, why are top-notch public health officials, who we should be trusting to say nothing but advocating to, keep our water and beaches clean and all that kind of stuff and talking about immunization, they're basically advocating for public policy in a way that it can become a partisan battle. This is not good to see them in this political realm. Likewise, it was not too comforting to see Toronto's Chief Medical Officer, Dr. Eileen de Villa, attending a press conference alongside Toronto Mayor John Tory, where he was not talking about the nuts and bolts and basic facts of the coronavirus, but condemning hate and racism and misinformation and discrimination that was all happening. Now, when he made that press conference, that was back on Wednesday, that stuff just wasn't really happening. And when one of my colleagues asked him to give an example of these racist incidents and to back up his claim that people were calling for the Chinese Canadian community to be quarantined, I mean, that is quite something to say, he refused to answer the question. I don't know what was going on at this press conference. It seemed to be some sort of, well, let's get in front of racism in case it happens, or I don't know, were they talking about the fact that 2 or 3 idiots on Twitter were saying racist things, as 2 or 3 idiots on Twitter will always do? I just don't know. I think it was some sort of political correctness, well, just in case there is intolerance, let's sort of preemptively denounce it kind of thing. Politicians like to do that sort of stuff. Public health officials, though, should not be doing that stuff. They should not be doing the sorts of things that politicians like to do. They should be just the facts, ma'am, keeping it plain, straightforward. We didn't see that, and I think that troublingly compromised the integrity of Canada's public health officials at the very time when we need to trust them the most. Now, there is another politicized angle going on here, or it could be a politicized angle. Conversations about bringing Canadians back from Wuhan on different chartered planes, because of course flights are restricted, but different countries can say, we want to get our citizens out. Now, there are about 250 or so Canadians in Wuhan, and 180, 190 of them or so have said, okay, we want to come back to Canada. Now, there are a number of other countries who are doing this, and they are quarantining their people for 2 weeks. That seems to be the protocol that other sort of developed nations, like-minded countries to Canada, is undertaking. But at the time of me recording this right now, and I know this stuff changes pretty much every hour, all the facts and figures and so forth, Canada was saying, no, we are not actually going to be quarantining it. And Public Health Minister Patty Hadji just said, if they show symptoms, we'll quarantine them. Why are we so out of step with other countries? And then there is the banning of the flights. There are other countries that the country itself, the federal government, has been banning flights from Wuhan or from China entirely. Here in Canada, we've had Air Canada, and I guess now other carriers, they have made the choice to pull back their flights, but not the government. And I wonder why. Now, we know Canada has a lot of problems with China right now that put at risk various trade measures and, of course, put at risk the lives and safety of people like Michael Kovrig and Michael Spavor. Could we perhaps be soft on our response to China and the coronavirus because of this? Because of our other relationship with China? That would be very worrisome to see. That would be the further politicization of this incredible health issue. But I'm left wondering, why is it that we are so out of step with what other countries are doing, so reticent to do it? And why are we haranguing and hectoring our citizens about misinformation and disinformation and so forth without evidence? I don't know what they mean. Are there people online and various online accounts that are saying completely ridiculous things that we should not follow? Yes. But there are also epidemiologists and health experts from other countries who are advising things be done differently than Canada is doing them. So do we trust those health officials? We're told trust the experts, but then there are experts advocating for things differently than Canadian health officials are asking to be done. Which is the misinformation and the disinformation? There's a lot of confusion out there right now, and I think that's only natural given how there are so many moving parts and variables. And I just think Canadian politicians and public health officials could be conducting themselves a little bit better right now to sort of calm the uncertainty and to get everybody on the same page.